Assalamu alaikum everyone and welcome to today's webinar, Fellowship Fast Track in the US, Mayo Clinic Edition. My name is Abdurrahman Muhammad and I'm a second year medical student at Al Faisal University and I am honored to be your host for this talk. Our goal today is to provide you with actionable advice from two incredible fellows who are currently at Mayo Clinic. We will cover everything from building a strong fellowship application to managing responsibilities and overcoming challenges. I am super excited to introduce our speakers, Dr. Harshvardhan Iyer and Dr. Emilliano Sanchez, who will share their personal journeys and insights. So let's begin. It is my pleasure to introduce Dr. Harshvardhan Iyer, whose work in neurosurgery and spinal research is truly impressive. Dr. Iyer completed medical school in 2021 from India and trained in neurosurgery at Bombay Hospital under the renowned neurosurgeon Dr. K.K. Turrell. After completing the USMLE STEP exams, he joined the Metastatic Brain Tumor Research Lab, focusing on circulating tumor cells and brain tumor research. He now works with Dr. Abudhi Iyama at Mayo Clinic, Florida, where his research centers on spinal fusion surgery, patient outcomes, awake spine surgery, spinal cord compression models, and cervical myelopathy. Please join me in welcoming Dr. Harshvardhan Iyer. Next up, it is my pleasure to introduce Dr. Emilliano Sanchez, whose dedication to medicine and research is truly commendable. Dr. Sanchez began his medical career at just 18 as an EMT and went on to earn his medical degree from Anáhuac University in Mexico City in 2022. During his studies, he gained valuable research experience in pediatric transplant surgery at the University of Utah and Intermountain Medical Center, focusing on clinical translational research in liver and renal transplantation. 2 years ago, he joined Dr. Alfredo Quinones Hinojosa's lab at Mayo Clinic as a postdoctoral fellow. His current research focuses on the glioblastoma tumor microenvironment and the development of novel CAR T-cell therapies against glioblastoma. Please join me in welcoming Dr. Emilliano Sanchez.
Sorry, in India as well. It's a 6 year or 5.5 year program. That is your MBBS or the MD that you get in Mexico. So I think you have to start early. I'm not saying that you have to start from day one itself, but like knowing or tipping your toes into what exactly the USMLE is, what exactly the requirements are, what specialty you want to do. If it's internal medicine, it would be a different pathway, it would be a different guidance plan. But if it's a surgical field, it has to be more geared and a little more methodical, as well as you have to put in a little bit of effort. So I started in second year of med school. I started like studying for my step exams. But again, see, like that was I did not have enough motivation to study while I was doing my med school stuff and classes and lectures and exams. So I kept going in and out of it. Then during COVID, while I was serving as a doctor, I knew that I wanted to go into the United States and do a neurosurgical residency. And that's when I actually started like gearing up my prep, starting with the steps, reaching out to faculty in the United States, to request if as a research fellow or a research trainee, I could do a research experience here. Um, but for me, it was very clear that I wanted to do the USMLE. For some people, it cannot be like a clear, and I know about Emiliano as well that he was very clear and he has like a testament to his progress to the United States and this amazing opportunity that he was also extremely focused and geared towards doing neurosurgery one and coming to the US to do neurosurgery.
Thank you, Doctor, uh, for your story. Dr. Emiliano, would you like to say a few words?
Absolutely, absolutely. I don't know. I think Harsh is right there on the money. He said very, very important things. I think my personal journey has been very blessed. First of all, I am from Mexico City. I Before starting medical school, I was in high school and I was not sure if I wanted to do medicine or not. So I enrolled as a voluntary paramedic, an emergency medical technician in a group, a very small group that had military training in order for you to graduate and be able to help people in ambulance service, no? And I was just a high school kid. I still like going out. I didn't know what to do with my life in terms of career, and I liked the patient interaction and the vulnerability that patients give and put in your hands and the responsibility that you have towards those patients really sold me into this field. Therefore, made the decision to go into medical school. I was initially going to come to medical school here in the US, but I stayed in Mexico City in Anáhuac University, graduated in 6 years. My favorite, probably one of my favorite times in my life, which I think that most of you in this conversation are in that point in your life. So I would cherish those moments, the learning, the experience, the friends you make are going to be there with you forever. And then while I was in medical school, I did multiple rotations in the United States, not necessarily knowing that I was going to pursue residency and training here in the United States, but I was just interested about what medicine looked like in other countries, specifically the US. So I started service in Salt Lake City, Utah, where I was working in the transplant department, pediatric transplant and renal transplantation service with Dr. Rodriguez. And I just fell in love with the system. I think it is a very well organized, fair system where doctors and nurses and everybody's working to the best care of a team. While I was doing that, I was not even contemplating neurosurgery. Then I came back, did my medical rotations in medical school, and that's where I fell in love with neurology in the pediatric department, not even neurosurgery. And that's where I started to learn about my boss and Harsh's boss, Dr. Alfredo Quiñones, Dr. Q, because as many of you know, he's a very public, importantly figure. His journey is beautiful. And for me, I was just a fan, right? And one day he came into my university and he gave a talk. They gave him a honoris causa degree in my university, and everybody were there. Like I'm talking about at least 500 medical students and professors. After his talk, everybody wanted a picture with him. And I was one of those kids. I just came to him, I shook his hand, I congratulated him, and we took a picture. We talked for 5 seconds, and then we said bye. No, months later, I emailed him and I said, "Hey, I want to learn from you. I want to be a student of yours. I'm interested in neurosurgery." Email came back as an error. I had the wrong email or the wrong address. Something happened, and I said, "Oh, okay, I tried. Nothing wrong in trying, right?" I wanted to do research with him, but sometimes it's not possible, as many of you know. 3 months later, he responds out of nowhere. He said, "Interview with my team." And long story short, I came to do an observership with him for 3 months here in Jacksonville, Florida. Came back to Mexico City, graduated medical school, and right after graduation of medical school, after doing step one, I came back as a research fellow. Currently, this is my third year now. I'm doing my third year of postdoc research fellow with him. Harsh is doing also his second year here in Mayo Clinic, Florida. And that's a little bit of my journey right now. We're mostly doing basic science research in the lab because it gives you very strong prospective data. And our plan is to try to match neurosurgery in the next couple of years. Hope that answers a little bit of the personal journey. We could continue to talk about this for longer, but absolutely, for the interest of time, we can move on to the next question.
Thank you, Doctor. That was really interesting. Now, for the second question, it is about the application. So, building a strong application is essential for aspiring fellows. Dr. Iyer, what strategies or resources did you find most helpful in strengthening your fellowship application? Was it research, networking, exam prep, or something else?
So as Emiliano said, like his pathway to the US was a little bit more different in comparison to mine. But there is both ways of actually looking at it. You can do, as in Emiliano's case, like we do an observership. You show that you're doing an amazing job, and he did an absolute incredible job from the senior fellows who were here, like being the first one on time, being the last to leave, being in the OR to observe the surgery, even though you might not be doing much, or just so that your boss or the PI or your preceptor sees that like this guy is always there for like 3 months. He can't shake the image out of his head that he's following me. And that actually puts in like the biggest and most amazing kind of credibility, as well as like a letter of recommendation to you, because he's seen you do it. Whereas for me, it was slightly less, traditional pathway, you would say, is where I did not have the opportunity to do an observership. And by the time I actually came to do like even a rotation or something like that, I had already graduated. So then finding a rotation became a bit more, challenging. So at that point, what everybody actually suggested was, finish your exams, uh, step one, step two. Uh, the other thing would be try to get involved in research in your own country, or try to get a mentor in your own country who might have really good and strong contacts in the United States. Show them that you're ready to put in a lot of effort so that they then can vouch for you and have a strong recommendation. So as you clearly mentioned, like for me, it was a little bit of or a mix of all three, wherein I had my steps done. I did not like, and I'm not this to say that I had a lot of research experience. I had one poster and one case presentation before I came here. um, I had both my steps done because that was one of the criteria that was put forward to me when I had to come to the United States. And I had a really good letter of recommendation from Dr. Turel, who is actually very world renowned and he has a lot of contacts in the United States. So those three things actually like, but fortunately or unfortunately for me, the thing was that he wrote an amazing letter of recommendation, and he's like, I want you to apply to my contacts, but I also want you to apply by yourself also using my letter, so that you are like uh, applying to all open opportunities and not missing out on anything. So it was, and rejection is going to be like a really major part of it. Like you're going to apply to people who will be like, "Hey man, we just what is it? We hired somebody just recently," or "I really don't have any time right now to be like a mentor or a preceptor." But my advice and suggestion to all of you who are so dedicated and are always putting in the effort would be that keep trying. One day it is going to work out. I can't be sure or guarantee, but if you keep trying and if you keep in this process for long enough, there is going to be a way. Like I know this with Emiliano, and I've had the amazing support and his constant guidance, because he has been like a constant rock for me. Where you have friends who are always there for you to fall back on, and the other thing is they've been through the same thing as you have, not in the same sense, or sometimes exactly in the same sense of it. And that is one of the most reassuring things. The only thing is that keep on, stick to the course, and it can be a different path. Like what Emiliano said, his slightly, indirect path towards discovery kind of thing that he wanted to do neurosurgery, or in comparison to like a little bit more traditional, wherein you do apply to your mentors and then eventually you get one chance, then you come here and prove yourself. So if that answers your question, I know I took a long route to it, but yeah, so because it's something that's very personal to both of us, because we have put in a lot of effort in this, and we are very grateful for the opportunities that have been presented to us. Definitely.
Thank you, Dr. Iyer, for the valuable advice. Dr. Sanchez, um, what about you? What did you focus on when building your application?
That is a really good question. I think, um, I think it has to be very multifactorial. I think you have to concentrate once you make the decision of following a path. In our case, is following the path of neurosurgery in the United States specifically. First of all, you have to know how to get there, know what you have to do in order to get there as a long path, and also break it down to steps. You cannot say, oh, I want to be a neurosurgeon in the US. I'm going to start studying brain anatomy today and spend my hours doing that. You have to break it down into, okay, what's the first step? What's the second? What's the third? Where do I need to take it from? So basically, for me, once I realized that was something I wanted to do, I started thinking about these things. So what I personally did is I talked to multiple colleagues that were on the same path that wanted to pursue residency in the United States, not specifically neurosurgery residency, but all other specialties. And they were also medical students, medical doctors with more experience than I have. For example, my first mentor, Dr. Rodriguez, he was also Mexican. He's from Mexico City, and he's an attending in transplant. And we became really, really good friends. So I had many conversations with him in his perspective on how to do this now. And he would tell me, okay, first of all, concentrate on your medical school, but also start doing rotations in the United States. Start thinking about your preparation for your exams, step one and step two. Start thinking about building your CV. So after I learned that, I knew that I had to focus on these three things, putting aside medical school. You cannot stop focusing on your medical school, your exams, because that also plays a very strong role. You have to do more than what normal people are doing, pursuing a path that is not as long. So for me, the three steps were number one, build my CV. I started to do as much research as I could. I had the fortune on working with a group where I published my first paper in medical school. I did oral presentations, poster presentations here in the US, in other specialties, but surgically related. You're not going to be able to build an impressive CV with tons of papers and tons of oral presentations with very directed work because you're still a student. You don't have the time to do it. But you start putting yourself out and asking people, hey, how can I help you here? What are you doing there? How can I have a publication with you? That's number one. And an advice I would give to everyone here is don't focus on the number, focus on the quality um, of your work. It's not about the number, it's about the story you can tell with your publications. Number two, I knew the exams were for us international medical graduates is very, very important. So I started to focus on how to prepare. And for that, I talked to a friend that was in the same path. He was bigger than me, and I had a meeting with him, and he broke it down. To pass step one, you need to do this, this, and that. So I took note, I committed, and commitment is a very important word. Once you commit to something, you have to give it your all. If not, you will fall back, especially in something as hard as this. And number three were the contacts. Contacts are still very important. That's why I reached out to Dr. Q to ask if I would come as an observer. I reached out to other doctors, but in my case, I was fortunate enough to have this opportunity. Some people get the steps done super fast. Some people get their CV done. Some people get their rotations done. Some people do it all. Some people do it at different stages. Each and every single path that I know is different. So focus on building your steps, your blocks with the goal in mind, and be able to pivot in case something doesn't work. Be able to know that sometimes the path is not straight, what you have to continue doing what you can and trying to figure out a way and enjoy it. That's very important too. So thank you for your question.
Thank you, Dr. Sanchez, for your very helpful advice. So now, moving on to the next question, it is about time management. It is a problem we all struggle with, including myself. So, Dr. Iyer, how did you manage your time effectively, and what advice would you give for balancing all the responsibilities of preparing for your USMLE while juggling research and clinical duties?
Thank you so much. But I genuinely feel like I'm going to give you my take on this because I was done with both my step one and step two before coming. But I am living and seeing Emilliano, my brother here, he is preparing for the step two and his work doesn't reduce, that is the one thing I can tell you and I can see. And he's done a champion share and a master job of actually managing his time and his incredible portfolio of various responsibilities while at the same time doing his step two exam. Yes, but I would suggest that at least have one of your exams done because that would be my suggestion to everybody. If both are done, that's incredible as well. For me, the main aim was, or what my strategy was, I know that I could finish my steps because my boss back home, Dr. Turel, was very understanding. He was like, "Yeah, please take time to study for your steps. And whenever I need you on clinic days and on surgery days, come on in. I don't mind at all. And you can sit and study there as well while we're waiting for patients or while we're waiting in clinic or while you're reviewing MRIs. But both of those were important, like what Emiliano said, that learning happens on the job. While I was focusing on my step exam and completely on like the biochemistry, the pathology for step one and everything else, I was also learning from him how to, like, I didn't know exactly how to read an entire MRI from start to finish. So watching him, and he took the time actually to explain because he was a bit further along in his career. So he had fewer patients and more time to teach, and he was very benevolent with that teaching time. As is my boss currently right now as well, that if you don't know something, they just don't be apprehensive to ask. But like coming back to the steps part was I was preparing for my step two while I was working for Dr. Turel because I knew I could get my exams done. But research back home in India was a bit, yeah, I would say it's not as resourceful as in the United States or even in Mexico. And he told me that, go there to learn and do your research. So my research was not that strong before I came here, but I knew that I wanted to finish my steps so that I could come here and do both. Like what Emiliano said correctly was like basic science research also, because I was really interested in doing cell work, wet lab work, animal studies, while at the same time even clinical research. And you're going to learn on the job really well because there is never going to be like a scarcity of study topics or a scarcity of projects for you. You have like in our department as well, like along with Dr. Q, we have this really very collaborative kind of effort wherein others also who might not have fellows, they give you the opportunity to put in the effort, to put in the work, and along with all your responsibilities, do projects for them as well. So that was my strategy. Like I finished my studies part and I came here and learned my research part. And because I was not had to manage my time with the step preparation at that point of time, um, my research was the main focus for me. And I was able to learn like the stats part for clinical research or the wet lab procedures like cell culture, making media, from A to Z. But it was like, yes, it was like going through the first 2 years of a PhD program in the first 6 months that I was here. Whereas for Emiliano, if you see, he had a really good and amazing research, and he took the opportunities that were presented to him really well. And at that point of time, he was like, I want to, come as a research fellow here. And so it can work both ways. You have to look what works best for you. Like if an opportunity presents you, please take it. Like don't feel apprehensive. And I know I'm saying this again, but and don't feel you are. This is what Emiliano says, and I'm really very glad he says this. Is You always have the no. You don't want to feel bad that you didn't even ask. And that would be my 2 cents on that point of that question. Thank you.
Thank you, Dr. Iyer. Dr. Sanchez, would you like to add a few words?
Yes, that's a really great answer, Harsh. I don't know if I can say much more than what he already preached, but if the question is how to balance your time, I think that that's a very deep question, and it's very personal for everyone because everyone has different responsibilities in their work, in their school, in their home, in their goals. What I would suggest, or what I think, is that priorities shift through time. When you're in medical school, when you're in high school, when you're in work, when you're higher level, your priorities will change. And I mean your work priorities, your school priorities, your family priorities, everything will begin to change. It's just a shift of priority. And you also have to decide what you're going to prioritize yourself. And that's very important. But for me, I think is planning on what you need to do, having a schedule in terms of time. And I think that balancing it out throughout is very, very hard. Even I think for everyone, I don't know a single person that has a very well defined schedule here where we are. But for example, when I was studying for, as I see here on the screen, the USMLE and my research and clinical duties, myself, I was on the service. My final year in medical school, I was in the social service and I was doing medical service at a school. It was primary, secondary, high school, and middle school. And I helped many kids that had, the classic kid that had a headache or the fracture or the anaphylactic reaction or whatever, the girls that just came to the office to ask me questions about life. I don't know. But I still knew that I had to do at least, I don't know, 40 questions of UWorld a day. And I still knew that I need to figure out how to help the patients in the school. And I needed to work on my research as well. So for me, I would go to the school, sit down with my coffee, do whatever I need to do in work. You should never put your study first than your work. Sometimes you have to do your responsibility first. And then once I finish that, I would just open my computer and bang many questions as I could. Went home, had lunch with my mom, dad, and they knew that I was on a very busy study schedule. So I would go to my room, not stay in the table to chit chat because time is money. I came to my room and study for more time, finished studying around 6, 7 p.m., went to the gym, sleep, and do that again. So it's a shift. Some days you have to prioritize all the stuff that is more important, like work, family, emergencies, and you're not going to be able to study or do your research. Those days are okay. I think it's very important to have rest days as well. Take the Sunday, take the Saturday if you want, because if you don't rest for at least a day, sometimes you're not going to be able. But if you can invest on a rest day, I think it's very important because you will start fresh with a fresh mind on Monday, and that's very helpful for me. So thank you for your question.
Thank you, Dr. Sanchez. So next question is, Dr. Iyer, you have worked on diverse research topics from metastatic brain tumors to spinal surgery. What inspired you to expand your research and how did it shape your career development?
Uh, Thank you. So, metastatic brain tumors was something that I was already interested and focused towards doing, along with GBM also. But this was the opportunity that was more clear cut for me, where I wanted to do both the basic science as well as the clinical part of it. And So if you go to see like pure numbers, glioblastoma is a deadly disease. but metastatic brain tumors is the most common metastatic as well as the most common brain tumor that you're going to see in practice as well. And the unfortunate part of that was that you don't know how it gets to the brain or what it does to actually achieve that access to the brain. And you don't have one faculty, like you've got prostate cancer, you have got bone cancer, you've got lung cancer, you've got breast cancer, you've got melanoma. Like practically every cancer that is going to be deadly or invasive has a pathway to go to the brain, and that was my main focus because Dr. Chachana, the first initial mentor that I had through this process, his main focus was on circulating tumor cells, that is, tumor cells that arise from these distant cancers in the lung, basically in the lung, so that we could study them, is to generate them in a lab and then see if they actually invade the brain. Uh, so we had a couple of successful studies, and then at that time, actually, Dr. Chachana as well as myself, we took stock of like after a year, of about 1.5 years time, we took stock of what next we would like to do with these projects, and we started applying to grants, and we are still waiting to hear. And at that point of time, in the meanwhile, he was like, why don't you even apply to Dr. Abodi Yama, who is doing an amazing job in spine as well? Because we were scaling down the lab a bit because he took up the responsibility of associate chair as well as he is the program director of our program as well. And I was more than happy. So then I was learning, but during that time I had the privilege of actually working on an in vivo study with mice, which I was practically running. And what helped me was that Dr. Abodiyama wanted to actually start his own rat model. So I had the required animal training that required to, start that project or even to write a protocol for the animal study. And at the same time, I also had clinical CRC training here, that is a clinical research coordinator training, which gave me the tools to even write my own IRB protocol, which is the Institutional Review Board protocol. So it was like, I was like a sort of jack of all trades kind of thing, that I knew the managerial part of both of those projects that he wanted to do. So that actually helped me, and I'm very grateful to both of them. We still work, or I still work with both of them, more so with Dr. Abodiyama now, on both the basic science and clinical part as well, because he studies opioid addiction in patients with back pain and who undergo surgery under him. So that was another topic that was really very interesting to me, because the opioid crisis is something that the United States is actually going through and has been going through for like a couple of years now, where it's not such a happy and nice kind of disease. You actually get to see the part wherein patients are not doing too well, and that is what I love about this system, is that the patient is seen as a whole person and not only as a disease that comes towards you, wherein even though care starts when they come with their complaints, you're looking to actually improve. And like you mentioned in my introduction, that we do patient outcomes as well, because that is something that is important. Fixing someone's disease or trying to move away from it or trying to cure it is amazing, and that is our job. That is our purpose, all of us in the medical field. Uh, but it's also, did you affect the person's or the patient's quality of life? Like if you take out like someone has a glioblastoma, but you take out almost practically half a lobe or something like that. At that point, recovery is going to look so difficult, and you're taking so much away of life from that patient that they might actually consider that I don't want to go through this therapy, or I don't want to go through this surgery. I want to enjoy my time here. Sometimes, maybe back home, we didn't think in that way. But here, they actually teach you from day one that the patient is your first responsibility, everything else is secondary. So, in both of these areas, in research as well as in clinical studies or in clinical practice, you actually get to realize that it's always patient centric in the United States. And that was like what called me to both the opportunities, the metastatic brain tumors as well, and then also spine surgery, because living with pain is something also which is very difficult, and it actually affects quality of life a lot.
Thank you, Dr. Harsh. Dr. Sanchez, your research has shifted from pediatric transplant surgery to glioblastoma tumor microenvironments. What prompted that shift and how has it influenced your career?
Thank you for your question. That is very good. I think that in the stage that we are in, personally, Harsh, as he just answered, and myself, and even as a medical student or even residency, I think the research that you do is because you are told or you are working for a PI, a principal investigator, or a doctor who specializes in that type of research. So if you want, I don't know, if you're still not doing research and you're interested in functional neurosurgery, find a functional neurosurgeon so you can work on what you like. If you are interested in tumor, find a tumor neurosurgeon. If you're interested in, I don't know, vascular, go to a vascular guy because you will be doing the research he is an expert in. And even in the field, there are subspecialties of research that you end up doing. Because, for example, I have colleagues like Harsh that specializes in metastasis research and now spine deformity research and awake surgery research. I have friends that work for Dr. Q that are experts in mesenchymal stem cell research. I have other friends that are experts in migration and stemness. I have friends that are experts in metabolism. And in my case, I spend most of my time doing immunotherapy, especially CAR T cell therapy research in GBM. This is because I had to adapt. When I came here, I was purely doing clinical research. I was very interested, and I am still am with Harsh, very interested in skull-based research, especially pituitary. And Dr. Q pulled me aside and he said, Emmy, I like your research that you're doing, but if you want to be a valuable fellow for me, I need you to be doing basic science research. And I said, boss, thank you. I have no clue what is basic science. I know how to work a pipette. I know how to, I don't know what the cell biology is, but I don't know how to work in the lab. I'm a doctor. And he said, Emmy, now you know what I want. That's your information. So I said, I have to adapt. Next day, I walked from the clinic to the lab where there were only PhDs, there were not MDs, only one of them. And I knocked on the door and I said, "Hey, I'm Emilliano. You don't know me. I'm a fellow with Dr. Q. I want to learn from you. Who needs an extra pair of hands? How can I help? Who can I learn from?" And I started learning from whatever I could get my hands on. I started learning how to pipette, how to do this, how to do that, not related to what I'm doing now at all. But I started learning, and when opportunities come, you need to know how to take them. In my case, we had to sit down with Dr. Q and we had to say, okay, we have to specialize research. Who's going where? And I didn't care back then. So one said, "Oh, I want the mesenchymal stem cell." One other guy said, "I want the nanoparticles." One other guy said, "I like clinical trials." And for me, what was left was CAR T cell therapy. And I said, "Oh, well, I'll take that." Little did I know that it is probably the most translational research going on in the lab, at least on GBM,
Absolutely.
for patients. So I was lucky and I adapted, I pivoted, and I have to be flexible. Sometimes you're lucky, sometimes you're unlucky. I think that sometimes you think that you find resistance into going into a type of research and you said like, oh, I don't like this. I don't like this research that I'm doing. I think it's a waste of time. I don't know how to do it. I'm very comfortable in, I don't know, putting data. I'm comfortable in this area. I think that an advice that I could give is get out of your comfort zone because that's where you learn. And most times you will be very happy in the path that it will take you. So it will happen all the time. I think your research will depend at this point. to who you do research with, even the faculty that comes into our department to speak. For example, we had Dr. Fessler, who is the chair or was the chair for 19 years in Roche in Chicago, and he's very famous. He's a spine neurosurgeon. And someone asked him, "Hey, how did you end up in spine?" And it's his passion, right? And instead of saying, "Oh yeah, this is what I wanted to do since I was a kid," he answered, "Oh, because in my residency, most cases I did was spine. So naturally, I just end up being a spine surgeon." And that's how life works sometimes. Sometimes you're where you're supposed to be, and you just have to follow it and learn how to be with them. Have a nice attitude towards it.
Thank you, Dr. Sanchez. That was really insightful. So moving on, um, mentorship is one of the most important elements in securing a fellowship. So, Dr. Iyer, how important was mentorship in securing your fellowship, and how did you identify and build relationships with your mentor?
Absolutely. And I could not put it better. Like what Emiliano said, being adaptable. Like you're not a PhD. You've just come freshly out of med school. Sometimes you might have not even completed med school. So you know what your strengths are. You know what your weaknesses are. But one thing is that always be ready to learn. Emiliano and I, when we came here, Emiliano was here before me, but he was doing the clinical part. We did the in vivo part together, and we were both clueless. We made fun of so many things. But now, like the guy to my right now, he is an absolute incredible beast when it comes to doing in vivos. He might have done like I can't even count the number of in vivos he's been responsible for because there have been points where I have helped him and he has helped me, but that the one thing is that case presentation, yes, you don't know, you do the first time, you learn, you're good to go. You do that so many times practically, like that you become an expert at it. Like it becomes a cakewalk. For me, something that was new to tell you guys was that I've never edited a surgery video back home. But here, whenever you do a case presentation, you have to edit the video yourself. And that was a learning experience. So imagine from not doing a single video ever to having done like 20 or 30, where even one of them got published for a far lateral approach, which is a really very nuanced kind of surgery approach. So you don't know what some opportunities are going to get you, and always be ready to say yes. I know we're all guilty of it that we say yes to so many things that we don't even have the time. And as you said, our schedules are so, even though we have a schedule, it's so flexible because it depends upon what your boss needs from you and what he needs you to do. Like, okay, you're working on a basic science project right now, and your boss is like, hey, Harsh, amazing job on that. Or sometimes you don't even get the acknowledgement, and because they're busy people, they have 5 minutes, they'll call you and tell you, oh, I need this surgery video edited, and can you sort through these 500 patients so that I can know what procedures I did within the past 1 year or what the department did within the past 1 year. And you have to be in the split decision of a second. Absolutely, sir. When do you need me to meet you? And that readiness actually helps you and that builds your character as well as your if think about it as a bank. Every time you go and say yes, you do a good job, you do what your mentor or your PI wants you to do, you're actually building trust and interest with them. You're putting in your deposit, and one day it's going to be like, I trust Emiliano with this, and I'm going to go towards him to do this part. Oh, I trust Harsh with this. I'm going to request him to do this part. So because the thing is, your mentor as well as your PI, they're going to have very limited time. They are not going to be people because they've got active play. Imagine seeing 23 patients per clinic day, 2 times a week, that is on Mondays and Wednesdays, and then also doing surgery for the other 3 days, wherein you're in the OR and you've got 2 or 3 procedures. They want you to, like, they will have a problem. Yes, ask for guidance. You don't want to do something that goes against your boss. Take your own decisions also initially so that you know that, oh, Dr. Abodiyama likes things done this way, or Dr. Q likes things done this way. And then they will come back with feedback towards you. Or if you do an amazing job, they're like, perfect, let's send it out. But within that limited time, you have to learn how to give them solutions and be as resourceful and helpful as possible. That would be, and then that mentorship does come in, because at that point you have put in so much good faith that he'll be like, Emiliano is a brilliant guy, or Harsh is a brilliant guy, and I really want him to match. Or they might put this statement across saying that if I had a residency position, I would be more than honored to give Emiliano or Harsh the residency spot, because they've been ever ready and they've always been ready to do everything that has been asked of them. There might be things that sometimes they ask you, you don't know how to do. It takes a little learning to do it, but you have to be ready to figure it out. Ask people who are working in the same department, that, oh, I did not know this, sir, but I found out from this person that this is what needs to be done to submit a protocol, or this is what needs to be done to do an animal study. This is the regulatory documents that we want, or I reached out to this person. So you have to be quick on your feet and in your mind as well, and be very resourceful. And that's when your mentor recognizes that, yes, this guy is worth the time, the effort. And it's not going to be like, 1 hour or 2 hour discussions. It's going to be 5 minutes, but those 5 minutes are the most important, because he sees what you've been doing for a week in 15 minutes time. So you have to be, bang on with everything that you're doing, and be on top of your stuff.
Thank you, Dr. Iyer. Dr. Sanchez, how did mentorship play a role in your fellowship journey, and what advice would you give to others seeking mentorship?
It's a great question. Thank you, Abdullah and Harsh. That was a great answer, by the way. Thank you for the kind words. I think that mentorship is is very, very, very important. I think there are two types of mentorship. I think you have the mentorship of your your boss, but also the mentorship of who you're surrounding yourself with. So you have those two kinds, and you receive mentorship from everyone you surround yourself with. So starting with that, try to surround yourself with people that are bright and much brighter than you. That way you can learn, and indirectly you're pushing yourself forward. You're competing and you're learning from them each and every single day by example and with questions, and you become a family. And also choose a good mentor if you can. And sometimes they will give you different types of mentorship. For example, the first mentor I had, Dr. Rodriguez, the transplant doctor, he had zero time, but he would love to speak and spend time with us. So we would just sit down for hours and talk about everything about life. We would do road trips, we would talk about career, family, even personal life. Whereas with Dr. Q, the time is very, very, very extremely limited, to the point that you have minutes to say what you're doing and what you have done. And you got to learn on how to give this transparent message back to them so that they know how valuable you can be. So they will always be very different. You will have to be very grateful and try to subtract and get the best out of them. Um, for example, from Dr. Q, who is the president, the founder of Mission Brain, the mentorship I've had from him is more in regards to his leadership than in actual science. He is brilliant, but I think what sets him apart from other people, and that what I have learned more from him, is his work ethic. He was the chair of the department. He's named professor of neurosurgery. He's dean of research. He's basically achieved all the milestones in neurosurgery, and he has a family, and he still works more hours than us.
Exactly.
And we work basically almost 24/7 to the point of waking up to go into sleep 24/7. The only break you have is lunch and your gym time. On the weekends, you have more time, of course. And he still works more than us. So for me, that's an example. He's very humble. That's another example. And overall, he never forgets. You would say, "Oh, he asked me this, but he has like 100 people working for him, so he will forget about this very small thing that he asked me 2 months ago." Well, newsflash, he didn't forget, and he's asking you about it on a Monday morning on a phone call while waking you up. So you learn as you go. And from the second part that I was mentioning, the mentorship that you have from your peers is almost as equal as important. For example, Harsh, he taught me how to do a lot of cell work techniques when I came back to the lab. And I remember perfectly, he sat me down and he took me through everything. And he's not my mentor, he's not my boss, but he had the time and the capacity to take out time from his schedule, and I still do the things he taught me, you know? And for example, the he mentioned surgical video editing. I remember the first presentations you have as a fellow, if they are big, you will the first one you will be nervous 2 weeks in advance. You will start doing your presentation 2 weeks, 3 weeks in advance because you're nervous. You want it to be perfect. You don't know how to do it for one hour presentation. And just to give you an example of this mentorship and how easy it goes, last week Harsh had a presentation, and he's on Friday morning, and he started preparing his presentation on Thursday night. He basically went home after work. He slept from 5 p.m. to 9 p.m. so he could get back to Mayo Clinic and prepare his presentations hours before the presentation. So I think that kind of mentorship and role modeling is very, very important. So you should the advice that I give to everyone, which I'm nobody to give advice, would be surround yourself with people that are more brilliant than yourself. And I've had that blessing in my life because they will directly pull your game up. If you surround yourself with people that are fun, but they don't pull your game up, you will continue doing that. So that's my piece of advice. And the answer. Thank you for the question.
Thank you, Dr. Sanchez. That was really helpful and interesting. So moving on to the next question. Being an international medical graduate comes with its own unique set of challenges. Dr. Iyer, could you discuss any challenges you faced, such as visas, language barriers, or cultural adaptation, and how you navigated through them?
Um, See, the thing is, and the one thing that I will tell you, to be honest, is what Emiliano said was one, you have to be the hardest worker. There should be no one who tells you that, oh, why were you not here or why were you not there? That is one thing that you have to do. And he's telling me about, being here at night. There has been a day when Emiliano himself has gotten out of the OR at 11:40 when he had gone in at 7:30 in the morning. So the guy has had like a 16-hour surgery or an 18-hour surgery, a vestibular schwannoma, where he was needed to be there because he was going to get tissue. He had to record the surgery, and he had to like be there throughout the entire time. He's like going to the restroom also. I had to almost ask permission. So I would say the one thing is that there are going to be so many barriers that you can't even think about, and you have to learn to adapt to them, and you need to learn how to work around. It's never going to be a straight pathway. The language barrier, yes, absolutely, that is there, but I'm pretty sure that that's not going to be like the biggest problem that people are going to have to come here, as long as you know that you know um, what you're going to do here is you're coming here to learn and to work and put in as much effort as possible. The second thing would be that don't be afraid to ask. Don't be afraid to put yourself out there. I know it can be, oh, this person does not know me. How do I send them an email? What will he think of me? No, I'm not saying that apply to everybody. Like a PhD is not going to do, with all due respect, they are the most brilliant people, and they have been the reason that I can do so much of basic science research also, is all thanks to them. But the thing is that they are not in the position wherein they can help you in your clinical journey, if that is your main aim. So reach out to, like, the chairs of departments, reach out to people who are actively actually doing research that you want to do, and be very targeted with your focus. Like, you don't want to be asking someone when you don't know about their research at all, because then it just becomes another email that uh, uh, you know um, oh, this person, he doesn't know my research, or he doesn't know what I'm doing. uh, like, even reading the top paper, they might not be the senior author on it, so that might just be a paper which they reviewed or went through and were involved in. But go through their page, be very focused on the person whom you are asking for, because for you it means the world. For them, it actually is just a 2 minute or a 5 minute conversation, and you get that 5 minutes to actually show that you are actually interested and invested. The one thing that I do see, and with all due respect to all people here, would be that if you know that you want to do neurosurgery, yes, reach out to neurosurgeon. But it can't be a point wherein you're applying to every opportunity that is available, but you want to do internal medicine. So that would not be like the best use of your resources as well as your time. Barriers are going to be many. One is also the funding. And I know that I should touch up on this because that was something that both of us also struggled with. Because coming here, you have to realize it's a significant financial investment as well. But remember this: I know it's going to be difficult, and I'm not saying that I know everybody's situation. But it is, if this is something that you really want and you have really strived for your entire life, and you know that you can make an impact, and you're going to make use of this opportunity, think about it, that that investment is going to be really valuable. It is going to be really, really, really worth your while. And I can't emphasize this enough as someone who has had this conversation with Emiliano so many times, wherein, I've spent so much money. It's my mom's hard-earned money. She has, and your parents are going to be really very supportive. But the thing is, unfortunately, because you come as someone who doesn't have too much experience. If you have a lot of experience, then the story could be absolutely different for you. But if you are someone who's coming at a really primitive stage in their career, or like an early stage in their career, you have to be ready to do the same amount of work, the same amount of effort, irrespective of the fact if you are paid or you're unpaid. We've both shown to our respective, PIs and mentors, Dr. Q, Dr. Abodi, Dr. Chaichana, that we are ready to work irrespective of whether you are paying for our bills or you're not paying for our bills. Because that's the dedication that this field requires. And as he said really aptly, Emiliano, that Dr. Q has practically, he's like his career roadmap is what we aim to, and we can see ourselves that he plays a different game. Like, he is on a different level, he's in a different league than us, and with all due respect to him, what he has done is absolutely incredible, and we are very grateful for the opportunity he's given us. But he puts in that same effort even today. The man has practically done everything. He is dean of research today for Mayo Clinic, and he has been chair. He has been full professor at Hopkins. He has gone to med school at Harvard. He has done his residency from UCSF, which is the, even today it's the number one program. And like, as an IMG, we don't even like, like we're going to apply, obviously, but we don't know what's going to happen. But to be very honest with you guys, like the barriers are going to be so many that we can't even count them for you. There might sometimes be struggles with even co-workers, but to be very honest with you, that you have to learn to be the bigger person as well. Learn what is worth your time. Like if you know that something is hindering your progress, just set it aside. Think about it. I'm not saying that don't be upset or unhappy about it, but focus on your work. Because come tomorrow, if you give the reason saying that, oh, I was upset about this, you're going to be upset about many more things in residency than you're going to be than someone, saying something or being weird about the way you acted or something like that. So that would be my 2 cents. And yes, and one thing is that yes, do please focus on even, like if you want to do this opportunity, think about the financial aspect of it. Think about um, doing the what is it? Doing at least step exams or see what sets you aside from the major population of people that is going to apply for these positions. That would be my 2 cents on it.
Thank you so much, Dr. Iyer. Now, Dr. Sanchez, what were the biggest challenges you faced as an IMG and how did you overcome them?
I think that as an IMG, as an international wanting to do residency here specifically, a very hard one. It is harder, way harder, because it's fair for the country to give more positions to their own residents. That's fair. And I think that for IMGs, they have to push harder to compete against these people. So you're basically competing not only with the best students and doctors in the United States, but you're also competing about with the elite of the elite from Canada, Mexico, Brazil, Argentina, Saudi Arabia, China, Japan, India. So basically, you're going to be competing against the best of the best. You have to know that, commit to that, be unique to yourself, and as Harsh said, know what's best and know what's your differential with them. And I think that there's a very nice thing that you can do because when you're an IMG, when you're an underdog, in this case, you begin to build a little bit of a syndrome where you feel like you have to do more of everything to be taken into consideration for match purposes. So what I mean is that this syndrome makes you work harder, makes you push harder, makes you study harder, bring better results, and it will translate into your career throughout your lifetime. So it is somewhat of a curse, not a curse, but it's uphill as an IMG. But this uphill learning that you will make will give you many blessings throughout your life because you will be ready to study and work harder than everyone else. It is very possible. There are multiple examples. And I think being an IMG and being surrounded by IMGs gives what we do a little bit of a beauty because the diversity is incredible. I didn't have this in my country. I sit down with people from all over the world, like people like you that I learn when they come here to Mayo, and I learn your culture, your language, your tradition, and I don't know. I think being an IMG is also a blessing. I think you need to use it as your advantage, and yeah, those are my 2 cents.
Thank you so much, Dr. Sanchez, for your 2 cents. Uh, so before we wrap up, we have a few questions from the audience, if you don't mind.
Absolutely.
So the first question is GPA a determining factor for matching into neurosurgery, or can it be overlooked?
It can be overlooked. I think that everything can be overlooked, even a very low score in the steps. But if you have a normal low GPA, you can overcome it by excelling in other stuff. If you have a low GPA, excel at research, excel at your steps. excel at your contacts. If you have a low contact, excel at other things. So if you are low on something, you have to excel on the other. And we see examples of this every single day. It can definitely be overcome. I'm not going to tell you that it's easier. No, the more you have, the better, but definitely you can overcome it.
Thank you, Doctor. So next question is, as an IMG, many of us have financial struggles when going abroad. So do we need to start unpaid first or not? And if not, how can we start paid?
I think most of the times you start on paid.
Mm.
As per my knowledge, it is very, very difficult to start with a paid position to do research, especially as an IMG. So everyone I know give at least 6 months, at least a year of unpaid. Sometimes you can get paid earlier, sometimes you cannot get paid even if doing the best job in the world. We have examples of people still not getting paid after 1 year, not because they're bad, but opportunity is not the same for everyone. So it varies. You can be paid or unpaid. It's a measure of sometimes luck, where you are, who you're knocking the door to, and overall, if you bring something very valuable to the table and speak to the PI and say, I'm going to be doing this, this, and that, and I can only come in a paid position, it will be harder for you to get the position, but it certainly can be done. So I personally don't know of an example on the top of my head that came to the US fully paid to do research from day one, but I'm sure it can be done.
Thank you, Doctor. So, okay, so moving on. If you want principal investigators when you go for observership as a second year student, how do you go about asking the doctors for research?
So uh, the main thing would be that he has to be comfortable with you. Like, don't go there on day one. I know this
Mm.
can be like sometimes you come for like 4 weeks or something like that, but don't go in the first week and ask them. First week, just be there to observe everything that they do. You can maybe ask the resident if there is a project that they're working on, because off the top of my head, your best bet is going to be doing a clinical paper rather than being involved in basic science research, because basic science research takes, an incredible amount of time and effort. So it would be the residents, it would be the fellows, if they have like active fellows actually doing research. Tell them, oh, I would love to be of help. I might not know this, or I know this, I know how to do this, or perfect. Like if you have some data that you would like me to do for a statistics project or something, or get involved in a systematic review, because while you're there, your institution might have access to papers and publications, so that you can get all the data and then come back home, continue working on the systematic review, and then have it published in some time. So that would be my methodology of actually going through the process or doing data collection, because residents, fellows, even mentors, they are not people who are going to have too much time to do data collection. And but then tell them that, oh, if you have a data collection project, I would be more than happy to be involved within my time here. If you show me what needs to be done, I would be really very grateful to be included in this opportunity. Case presentations or case series is another way to get involved and included. And mostly, yes, and ask, don't feel like, oh, this person is a resident, they don't do the research I like, or something, I'm not going to ask. They might be doing something that you might not be aware of. So go ahead and ask them. And anything at this point, anything that comes in your plate initially when you're starting out, and as you actually build up that portfolio, then you become selective. But within this 3 month period, like we have had students from Saudi itself who've come here and have been an incredible help to us for our data collection projects. They've been incredible help for systematic reviews. They've had poster presentations done here. So uh, that would be my way. And ask for opportunities, and opportunities are always there around the corner.
Thank you, Doctor. So one last question. Um,
Yeah.
How do you guys keep motivated while doing all this work? And how do you ignore all the negative thoughts and pressure?
That is
That
a
is a
really brilliant question.
please take it away.
It's all thanks to, my amazing friends, my amazing co-fellows with me. It does get tough. It does get a little bit dark as well. But to see your fellows who've been through, and your brothers actually, they understand you much better than anybody else because they're going through the same thing with you. You're going to have tough days. The tough days at times are going to be more than the happy days. But always keep reminding yourself, or at least have friends who are there to remind you that what you are doing or what you are trying to accomplish is not easy. It's never going to be easy. If you feel that getting here and getting this position is easy, no, it's not going to be easy. And you're going to have those tough days. So I'm not saying that we don't have bad days. We both have bad days. We've had days where we just pick up the phone and just vent to each other. And but yes, have people who you know are going to have your back always. Not many people, but those one or two few people who you know that if suppose you even call them at 4 a.m. in the morning, or if it's like 7 a.m. in the morning, whatever time, that they are there. What do you need? We are here for you. Just tell us where we need to come. That is all you need. And these guys will be there for you. And I'm very grateful to say that Emilliano, one of our other boys, and our brother, JP, who is also a really amazing part of Mission Brain. Um, it does get difficult, and being able to talk with each other, they always have, 5 minutes, 10 minutes, 15 minutes. They will always take the time to speak with you. They've gone through some similar thing. They will have some insight, or they will always be there to listen to you and take advice from everybody, but be very careful whom you take. Like, that you want to be where Emiliano is. You know where you want to be where Dr. Q is. So take advice from people who are on the path to achieving, or have already achieved what you have done. There will be lots of other people also who will tell you that, oh, trying to do neurosurgery or trying to do surgery or trying to do any kind of surgical branch in the US is completely impossible. I will tell you, I was of the same belief. Everybody has told me, oh, if you're Indian, just go to do internal medicine, that would be your way to go through it. Our program, with all due respect, has got an Indian IMG uh, as a PGR4. He will be PGR5. There is a very, like, a mentor as well as a friend who is PGR2 right now. We have somebody from Italy who is also PGR3 right now. So don't think just because their stories were not public or they were not in the limelight, then there are not people. There are people who have been doing this as IMGs also and getting in. You just need that one opportunity, and you need to keep reminding yourself that you've sacrificed and you've dedicated so much not to go back home or not to, fail. And if you shoot for the stars, you will at least, and you miss, you'll at least land on the moon. That is what has always been on our mind. And but yeah, having people whom you can fall back on and people who are always very dependable for you is very important. And that would be, if I could sum it up in a good way, and it's going to be a roller coaster. I would be very honest about that.
Thank you, Dr. Sanchez and Dr. Iyer, for taking time out of your packed schedule and for sharing your experience and advice. Your insights have been incredibly valuable, and I'm sure our audience has learned a great deal. Thank you so much.
Thank you so much for everything and having us. Have a great day, and you guys are amazing. Keep doing amazing work.
Yep. Thank you so much, guys.
Thank you, Doctor.
Thank you so much, Doctor.